Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight podcast.
My name is Gordon, and I'm here with our public health panel, Ben, LaShawn, Will, and a special guest who will be introduced later.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
The Food and Agriculture Organization of the United Nations, FAO, published a report indicating that the pandemic will create a shortage of food for some populations. Initially, not because of food scarcity, but rather because of a strain on food supply chains. In this episode, we'll be discussing an article by Jesse Young titled, "The Coronavirus Pandemic Could Threaten Global Food Supply," UN warns, and the extra supports that are needed to keep the agricultural industry afloat. One of the longer-term consequences of a disruption of food supply is the incidence and prevalence of food insecurity. To discuss this important issue, we have invited a special guest. Jessica Schill is currently a policy advisor with the Beef Farmers of Ontario, where she maintains various farmers' physiological and psychological wellness portfolios and reviews government food safety, labeling, and sustainability policies. Jessica is also a registered nurse and graduate from Western University's Master of Public Health program. She's a lifelong advocate for agriculture and rural healthcare, having grown up on a grain farm outside of Palmerston, Ontario, and having practiced as an RN at a small community hospital located in Chesley, Ontario. Jessica's professional goal is to further define and promote the link between agriculture and public health as it relates to Canadians and our global community. In part, Jessica is a foodie and loves putting a creative spin on traditional recipes. She hopes to write her own cookbook one day. So, thanks for coming on, Jessica.
Thanks for having me.
So, the reason we brought you on is to get your expertise on how the pandemic is affecting our food supply chain and what are the long-term consequences on things like food insecurity and the public health consequences of food insecurity. So the best place to start here is if you could maybe help us to describe what food insecurity is.
Yeah, for sure. So there's definitely two different ways of looking at food security and insecurity. So it's kind of the availability of food, if that physical food is there, and if you have access to that food. But then there's also some other factors that kind of go into food security and insecurity. So, do you have the physical means of that food? Is that food there for you to purchase or to get? And can you afford it? But then is there also enough? Is there enough to go around for your family? Is there enough to go around for your community? And is that food that's there, healthy and balanced and contributing to an active lifestyle? Also, there's kind of the subjective view of food security. So is there access to good food? And good food is definitely different for every person or every family. And that can kind of bring in some cultural variability too, because what good food might be defined by one family might not be the same for another family. And especially if it's culturally appropriate for that family. And then there's also stability. So sure, you have maybe enough and maybe it's good quality, it's healthy, but is it a stable supply? So is there going to be enough food for this week, maybe next week, next year type thing? And is there enough to go around for everyone and in that stable supply? So yeah, there's a lot of factors that go into it. So in terms of security versus insecurity, security would be having access to that food and meeting all those factors. But then insecurity would be quite the opposite, where you maybe don't have access, or maybe you're of a lower income family and you can't afford, healthy, nutritious food. It might not be an option for your family. And same with, maybe you live in an area where maybe you're of a new immigrant family and you don't have access to culturally appropriate food.
Yeah, so it seems like, as it is with many other factors in society, the socioeconomic lens and just whether an individual or a family has the financial means to get food plays a big role in determining if they are food secure or insecure. Do I understand that correctly?
Yeah, I would definitely say that for sure. Social, economic, and cultural factors definitely play a big part in whether you can consider yourself food secure or insecure, or even the location you live, is your location that you live in food secure or insecure. So yeah, it's pretty complex, a pretty complex issue, I would say.
So I've heard these terms kind of being thrown around when discussing food security / food insecurity. The first one I've heard is called a food desert.
Yeah, I've definitely heard that term used, especially in rural areas or maybe different urbanized areas where there isn't access to nutritious food. So in terms of a food desert, is there a grocery store that's nearby? Is there restaurants nearby? And are those grocery stores, maybe convenience stores, food outlets, do they have or are they supplying healthy, nutritious food? And I think food desert's definitely something you can consider when you live in a more regional or remote area, because you might not live in close proximity to a grocery store or a food outlet. So you really have to prepare for your next meal much farther in advance if you live in a food desert, I would say. But even in urban areas where there is lots of grocery stores and different food outlets, sometimes the food outlets or the restaurants that are there aren't supplying healthy, nutritious foods. And I think that could be considered a food desert as well.
Okay, yeah. So I guess that accessibility and like affordability component comes in, as well as I guess the quality component comes in as well.
Yeah, for sure.
That contrasts nicely with another term we've also learned, which is a food swamp, which the way I understand it is an abnormally high concentration of fast food restaurants in kind of poorer neighborhoods, which is almost a parallel but opposite problem to a food desert where you don't have access to maybe good and nutritious foods. So, just thinking out loud, I'm wondering, if people are going to start maybe eating out at cheaper fast food restaurants and taking stuff home. We know that delivery in a lot of communities can help to bridge the gap between, maybe you don't want to take a 30-minute bus ride to go to the grocery store, but then, you have apps like Skip the Dishes, and then you can get McDonald's to your doorstep in 20-30 minutes. So this also makes me concerned about, maybe more people will start to eat unhealthy food.
Yeah, and it's definitely something I think policymakers are considering as well, because right now we haven't quite seen the price inflation in the grocery stores for fresh fruits and vegetables yet, but I think it's definitely going to come soon. And then that's when, families are going to have to consider buying fresh fruits and vegetables or buying food that they can afford. And sometimes, McDonald's is cheaper than buying a full cart of groceries, which is pretty concerning. And takeout is very accessible. And for those families that live a very busy lifestyle, sometimes they don't have time to reach the grocery store and things like that. And if you have 5 or 6 kids, it's already busy enough as it is to try and balance all of those responsibilities. So I think there definitely is going to become a surge where we see a lot more people striving for unhealthy options, whether it be takeout or even less nutritious, quick, fast foods, such as chips and sugar, like high sugar foods, because they ultimately are cheaper than buying the fresh fruits and vegetables. And I think we will see that to come when we start to see an inflation due to the lack of availability of the fresh produce and fruits and vegetables and stuff like that. So I definitely think the food swamp, which is an interesting term, might be something we have to consider, and definitely policymakers are going to have to consider in the future as well.
You brought up a good point regarding inflation of fresh fruit and groceries and all that stuff. I was wondering, from your expertise, how does this extra pressure on the food production chain influence the incidence and prevalence of food insecurity? So, for example, the Food and Agricultural Organizations of the United Nations reported that the pandemic will create a shortage of food for some populations, not because of food scarcity, but rather through a strain on the food supply chains. So I was wondering if you could have any comment on that.
Yeah, for sure. I think that's a really good point. And the food insecurity that's going to come out of COVID-19 is going to be one that defines the difference between low income and high income families, especially when it comes to access to high quality food. So people that have the means to buy the inflated produce, they'll be able to afford that and continue life as normal. Whereas the families that are maybe of lower income status or aren't working right now, when those prices do inflate, aren't going to be able to access those. But the availability won't necessarily be the problem, because we'll still have it. With our strong import and export markets in Canada, we'll still be able to get things like tomatoes and bananas and different things like that. And if we can't grow them here this year, so that's a positive, but it's also a negative because it's going to put a defining link between our population. But in terms of strain on the food supply chain, a big issue right now is going to be labor. So in Canada, usually we have, around our growing season, we have a lot of migrant workers that come to Canada to offer help during the growing and harvesting seasons. And unfortunately, due to COVID-19, only about 9,400, the 13,000 workers that come every year, are going to be able to get here. So that's going to place a lot of strain on the people that harvest and produce fresh vegetables and fruits like tomatoes and strawberries and anything you see that's seasonal. So that's going to be a huge issue. I know asparagus season is within the next month, and they're going to have some challenges harvesting the asparagus because they don't have the workers and the workers aren't here yet. So labor is definitely a big issue, not just on farm, but also in the processing section of the food supply chain. So they've had to change in different processing plants, whether it be livestock or fruit and veg. They've had to change how the employees can work. So, maintaining their 2-meter distance and increased hand hygiene. So then there's extra time needed and extra resources needed by the processing plants to house the employees. And then they've also had issues with employees that have tested positive for COVID. So then any other employee that has come in contact with them also needs to isolate for the 14 days. So that's definitely taken away from the amount of people that are able to assist in the processing side of the supply chain. So there is a bit of a backlog there, which is challenging because the stuff is happening on farm, but it's not necessarily getting to the grocery store just because there is that middleman and there's so many challenges around labor.
Yeah.
And then another big issue, especially in Canada, and I'm assuming it would be similar globally, but a big portion of outputs that come from primary production go to restaurants and hospitality services. And so agriculture in itself has taken a direct hit because that is a huge market for different products like dairy and eggs and chicken and grains. So unfortunately, in the first couple of weeks of COVID, we ended up with a lot of food waste just because our policies weren't ready to handle what we were going to do with redirecting food. So for example, some dairy farmers had to dump their milk. So, you work so hard for that milk all year round and you have to dump it down the drain because there's nowhere for it to go. And same with asparagus, for example, they're having trouble harvesting. So they may have to leave some of the asparagus in the field if they can't get it all out, which is really tough for them. You spend so much time putting all that effort in. But actually CFIA, so the Canadian Food Inspection Agency, has been really, I guess, reactive would be a good way to describe it, in making sure that we are able to move that food somewhere else now. So we're not contributing to that waste, and because there is people in need that do need it. So they've been able to reroute any food from primary production and processing that was supposed to go to restaurants and hospitality services to the grocery store. So I don't know if anybody's noticed in the grocery store lately, you can buy flats of eggs, which isn't something we would normally be able to buy. So that's a pretty great move by CFIA to be able to do that. And then as you're moving kind of through the supply chain, there's definitely some issues that come from consumer behavior, which I'm sure we've all heard about in the media, but that ultimately affects supply and demand. Yeah. So their food choice, the panic, even the limiting on number of products because of the panic, that really changes how the supply and demand equation works. And then it kind of is like a ripple effect down to the producer. So yeah, there's definitely lots of different spots in the supply chain where COVID-19 has hit and hit hard.
Yeah, it seems very complex.
We learned in our Master Public Health program about food waste, right? And food waste occurs at all stages of production from essentially farm to plate, right? So I'm wondering, as food becomes more of a precious commodity, I know there's going to be food waste because, farmers and distributors aren't able to move fresh produce quick enough to, if they export, there's a lot of, disruptions in transportation, for example. So there will likely be food waste occurring now. But, at the household level, we learned that a lot of food waste usually takes place there. But I'm wondering now if people will be more mindful of how precious food is and not waste or throw out some of the things that maybe they have in their kitchen that would ordinarily go in the garbage.
Yeah, I would definitely hope people are considering that, especially with how precious food seems to be nowadays. And even when you go into the grocery store, some of the things you want to buy aren't there. So I definitely hope people are considering that when they're making their choices in the kitchen. And even with the things they're buying, are they able to eat all of that by the time it's going to perish type thing? But I know that has definitely been a consideration at the primary producers level too, because they have been considering, should we plant this crop this year? Are we going to be able to harvest it in time? And is there something we could plant instead that we're able to kind of combat the other curveballs we're being thrown by COVID? So, a lot of producers, for example, who are planting fruits and vegetables are considering planting grains because they can do that on their own without the extra needed labor. So yeah, I think it's definitely the food waste is being considered at all aspects for sure.
Is Canada typically more of an exporter in food or an importer? And I'm sure it differs between like what kinds of produce and everything like that. And from there, I was kind of wondering like how this pandemic would affect countries who typically depend more on exported foods, or countries who get more of their GDP from exporting foods and things like that. So what I kind of want to just discuss is from an international lens, how this pandemic has affected various countries in the way they're reacting to it. Think of those smaller countries, maybe like smaller island nations who get the bulk of their food imported from other countries, right? But then with all this global bans and just restrictions for travel and even just shipping and all this logistical things being put on hold, how are they affected?
Yeah, so that's importing and exporting and markets are definitely a complex conversation to have, but ultimately, at least in Canada, so our borders are still open for essential services. So we still are able to import and export, not necessarily fresh produce, because that's something we generally keep in the country when it's seasonal. But things like grains and whatnot are definitely still being considered for import and export. And I was thinking about this the other day, and I think it's interesting that it's going to be import and exports are a great thing to have. And it's going to be interesting to see how it looks in other countries because, individuals living in lower income countries, are they able to afford this food once it's imported? Because ultimately it's going to be more expensive when it's coming from somewhere else, right? And so I think that's interesting, but I think it is on onus of Canada to continue our exports because we are helping those countries that are maybe already in a humanitarian crisis and will continue to be or even in a worse situation when COVID-19 ends.
Is this potentially going to crush domestic agriculture in those low and middle income countries where they're maybe importing more than they normally would? And does it affect those farming communities for seasons going into the future? I don't know if you could speak to that.
Okay, yeah, then that's a really good question and definitely something that the news has touched on quite a bit lately. And I think it's interesting because agriculture looks so different in every country, right? And so when you're importing, you definitely are throwing an extra wrench in the balance, right, for trying to spread out and support your domestic agriculture, but then also, make sure you're feeding everybody at the same time. And so I know a huge issue that they're seeing in different parts and different countries in Africa right now is a lot of farmers aren't able to work because they've either fallen ill or also the labor restrictions. So they're hoping that other countries will continue to import because they're kind of relying on bigger countries like the US and Australia and Canada to continue to send food their way. But then again, I don't know how that will affect their prices when it does get there because I'm sure it would be heightened. But yeah, it's a very complex issue, especially when it comes to domestic ag and how to balance your imports and exports. But in Canada, we are lucky that we do have a pretty balanced market, and we do import and export quite a bit of food, whether it be from the US or Japan and China. So we are lucky that way.
So I guess the issue of food insecurity, it seems to be a very big problem globally, right? Like the UN, in one of their reports from 2019, they mentioned somewhere around 820 million people around the world. It's like around 1 in 9 being affected by food insecurity, and particularly children are extremely impacted by this issue. Things like hunger, malnutrition, stunted growth, and all that stuff. So I was thinking how food insecurity is in fact a public health issue. Like how exactly is it, I guess, connected? Because a lot of people, when they think about food insecurity, they just think, it's agriculture related or it's supply chain related, but they don't make that health wink.
Yeah, and even just to extend the question, people think of it as being binary, like you either have something to eat or you don't. But I think what Jess was saying today is it's a little bit more nuanced. There's traditional norms that come into there. There's food quality and all those things that come into there as well.
Yeah, for sure. And actually, I was thinking back to discussions around a wicked problem because it affects really, like you said, all parts of the supply chain and different aspects of human life. And in terms of public health, food security looks different when a person is involved in it, right? So you can have anywhere between malnutrition and overweight to obesity. There's really different aspects, but then also when you don't, like, food plays such a big part in your everyday life. When you don't have access to clean or healthy or good quality food, it's impacting other parts of your day. So your energy level, if you have the energy to get up and do the things that you need to do in the day, even all the way to your ability to fight off disease, because having access to good quality food and clean water helps you build your immunity. And if you're not able to fight infections, then you're ultimately, things with COVID, you could be predisposed or you could be more apt to get it. And also when you're battling with things like malnutrition or undernutrition and overweight and obesity, you're constantly dealing with chronic inflammation. And so chronic inflammation also kind of triggers other things in your body that could predispose you to getting ill. But then longer, if you're looking even farther into the future, if you are battling with different things as part of malnutrition, you're looking at diabetes, chronic heart disease, even some respiratory issues, you're predisposed to. So having access to good quality food ultimately determines and is part of living a healthy life. And if you're able to, even mental health related things, having access to healthy food and eating a healthy diet helps you to improve your mental health and well-being, which is so important, especially in times like COVID-19 when you're at home by yourself. So
Right.
definitely super important there. It's almost like a spiral effect. Once, if you're food insecure and you could be predisposed to so many other conditions when your body's not getting the proper nutrition it needs.
Yeah, that's a good point. And, even we've talked about low and middle income countries, but, food insecurity is also a problem for even high income countries like Canada. It's kind of a hidden problem to a lot of people. In Canada, about 1 in 8 households are food insecure, which is equivalent to about 4.5 million people. When we talk about stats on food insecurity, a lot of times vulnerable populations like homeless people or even First Nations people living on reserves aren't even captured in that data, and they are disproportionately affected by food insecurity. So I would caution a lot of people when they read stats to think the problem is probably a lot worse than we can actually measure. And then another point as well is that, as you mentioned, children who are, in the critical age of development, if they are not receiving the proper food and nutrition that they need, that brings a lot of problems in the future for developing diseases.
Yeah, like when I was think about food insecurity and its connection with public health, like the first thing that immediately comes to my mind is just how closely related it is with social determinants of health, right? And I think immediately to how much vulnerable populations, like under the umbrella of lower SES communities or just groups, there's like a subgroup of like vulnerable populations within that who are even more further disproportionately affected by food insecurity. And I guess groups that come to mind for me are typically, women and children who, I know in many parts of the world, a lot of times in the global south, when gender equity is still an ongoing struggle and an ongoing something to achieve, right? And here just comes up issues of things like land rights, access to credit or resources for women to be empowered, for them to be able to be part of that decision-making discussion and to be thoroughly involved in the whole food production, or just even so that they have agency to be able to go out there and work and have money so that they can support the family and not have to depend on others. I just think that it's a very important point to make. and also just how for even for just children who don't have that food, the access to good food, it affects things like developmental stunting, physical or psychological, and just all kinds of development, and how it can affect them further down their line in their life and things like that.
So with this said, we can see that malnutrition is one of the biggest drivers of premature mortality in the world. A lot of people do die from not even just undernourishment, just from hunger. And as Will was making the connection, socioeconomic status is very much related to income, what you eat, and your chances of survival and not getting a disease later on in life. So when we look at the whole scope of the problem, what are some of the things that we can do to keep the food supply chain going so that our vulnerable populations do not get more food insecure than they already are? And Jess, maybe you could speak from your policy lens.
Yeah, that's a great point. And actually, just out of the U.S., and I don't always, I'm not sure if I always agree with things that come out of the U.S. that have to do with COVID-19, but actually, the U.S. Very recently has decided to support their producers and also support their communities, their vulnerable communities, with what they're calling food boxes, which I thought was really interesting. So what they're doing is food that isn't being rerouted in the supply chain. So much like I talked about earlier, things that were supposed to go to hospitality and restaurant services that maybe can't be used in grocery stores. What they're going to do is the U.S. is going to repackage those and put them in boxes and donate them to food banks and community churches and faith-based organizations and any other service type community organizations to distribute that food to families that live in those communities that are of vulnerable populations or lower income that might not be able to purchase groceries when inflation does happen. So I think that was a really cool approach made by the U.S., though they haven't released too many details about it, but they have said that they're going to commit $3 billion worth of funding to it. So I thought that was a positive. And in terms of policy here at home in Canada, to keep our food in the grocery stores, we need to prevent having an export ban and import bans and stuff like that to keep both a good amount, good quantity, quality, culturally appropriate food in our grocery stores is really important. And then it's definitely interesting to see how other organizations, government organizations, are going to react in the future. I do think this was a learning lesson for the Canada Food Inspection Agency when they decided to reroute food from hospitality and restaurant services to our grocery stores. And I definitely think that was really important because we did see that panic buying and stockpiling at the beginning and the emptying of grocery shelves. And so now everything's starting to pile back up and look plenished because of the rerouting of food. So I think that's maybe a policy they need to consider for future as well. And maybe next, not hoping that we ever get a pandemic again, but maybe next time we'll be more prepared for something like that and to prevent a food shortage in Canadian grocery stores at least.
I remember when this thing first started, I went into the grocery store and I wanted to get, some fresh fruits. And the only thing that was there was half a not so ripe mango and a pineapple. And then the other day when I went grocery shopping, all the shelves were just back to the normal, quantities. And I guess, it's a really cool what they did with just changing that up and just making sure that the grocery stores were stocked first, since most of the restaurants were, kind of on shutdown.
Yeah, and another challenge too is, so a lot of grocery stores, I don't know if you guys seen this in your local grocery stores, but they were putting limits on different products, right? So your meat, definitely your toilet paper, things like that. But in terms of, being able to get the food where it needs to go and preventing the backlog, and I understand it was a response to the panic buying, but removing those limits in the grocery stores would definitely help remove the backlog that's also occurring in the processing facilities too. So we can keep moving the food through the supply chain and getting it to the consumers that want to buy it.
Wow. So that's I didn't even think of that. That's an unintended consequence of putting limits on items, that you kind of back up the food supply chain and maybe things don't move, things get wasted. I never considered that. So thanks for sharing.
Yeah, no problem. I know it's definitely true with livestock and meat products, because that was a big thing that limits were placed on. And, producers were worried because they've got livestock ready to be processed so that we can buy them and have them in our freezers and stuff like that. And there wasn't the movement that there was before.
So do you think, because I'm looking towards the future and how we can kind of move forward with this pandemic, and God forbid we ever have a pandemic ever again, is this opportunity great for the tech sector?
Or even automation on, the level of food production. So, if you incorporate tech or automation into farming and agriculture, is that something that's, is that a welcome technological innovation, or what are some of the problems that farmers might have with that?
Yeah, those are definitely two really cool points you guys bring up. So in terms of automation and tech in agriculture and even in the food supply chain in general, I know by primary producers, it's 100% welcome all the time. They love the idea of new technology because ultimately it helps them to be more efficient in their production, which is the goal, right? To be more efficient and produce better quality food all the time. And they want to make sure that they're producing the highest quality of food for our consumers. So talking about that, there is a lot of technological advances that have already taken place or are already in the process of happening, especially in Canadian and U.S. agriculture. So, for example, our planters, our corn planters, they're automated. So, for example, instead of overplanting a row or something like that, the planter knows how many rows to plant, and it will shut off its planters if it gets too close to another row. And the producer can decide how far apart he wants things so that he can make sure he's fitting the ultimate number of plants in that field to grow the best yielding crop. So basically, they're always using technological advances like that. Another one being in our sprayers. So a lot of sprayers, they're self-propelled now, so they can actually shut off the sprayer tips as they're getting close to the edge of the field, or if it's going over a spot that it's already sprayed, it'll shut off the tips so that they're not overspraying or anything like that, which is really cool because they're not wasting anything and they're doing the best they can for the crop and the soil health, which is really awesome. And then another kind of automation is now they have GPS software that can connect you to at home. So for example, a producers out in the field planting, he can see his maps can be downloaded to his phone or his MacBook at home, and he can see where he's planted and what's been planted there and really take a good look at things from home. And then that system will also allow the parts servicers to come over into their tractor and service the equipment, not like remotely. So they don't have to go into the dealer, take the tractor in. It can all happen in the field while they're still working, which is really helpful to continue, producing and being efficient in time and not having to take an entire day to go into town to get your parts and stuff. So yeah, there's definitely a lot of advances. And with those advances is also coming, there's going to be a lot more jobs in agriculture as well, and in food supply, because they're going to need people to troubleshoot and IT and tech to support these advances. And we are seeing that shift now with a lot of people studying different agricultural tech products and being involved in that way. So it's definitely a sector, agriculture is a sector where there's lots of room for growth with tech and advances, but it's definitely started. The ball's already rolling, which is really cool.
Yeah, so Jess, you talked about some of these advances, but do you think there will be some kind of negative implications of implementing so many technologies?
I would say at this point in time, it maybe isn't considered an issue. The RBC published an article, and basically what they were talking about was how all these advances in tech and these automations will actually produce a lot more jobs in the agriculture sector. And so I think that's a really positive part of this. And a lot of producers don't see it as a threat. It definitely is a challenge because, it is new and our farming population is of a growing age as well. So definitely getting new people involved in agriculture is a big thing and younger producers.
Right.
But the other challenge too with tech, I would say, is the access to data and Wi-Fi and internet here. So rural internet it's coming, but it's not everywhere yet. So a lot of farmland doesn't have access to, LTE and stuff like that. So that definitely poses some challenges on its own with just the access to maybe infrastructure, I would say. Yeah.
Yeah, well, Jess, thank you so much for all the insight that you've provided us today, especially just that last point about how transitioning and bringing in new technology might actually increase the workforce. Like that was something that previously I would have thought that changing technology would mean less people and more automation, but it seems like that's actually quite the opposite. So that's very interesting. I just wanted to close this off with more of a human moment. We know that you grew up on your grain farm, and we just wanted to ask how your family is doing in terms of dealing with this whole pandemic situation. How the community is doing in terms of the agricultural work and things like that. If you're open to sharing, that is.
Oh yeah, for sure. So in terms of my family, they are doing good. They're healthy and well, which is a plus. But it has changed the way the way they run their daily business. So instead of having mechanics and stuff come onto our farm and help with equipment and stuff like that, my dad and my brother are doing a lot of it on their own. And in terms of parts, the way you go in to pick up parts and stuff is definitely different. And my family's had to adjust by choosing only one person that can go do these different pickups and deliveries. And instead of having a lot of people come on farm, my parents are adapting to new ways of tech as well with Zoom and Skype. So they're doing meetings that way, which is nice. And my dad said their plant for 2020 will continue as normal as of right now. And it is nice that with a grain operation, nobody has to be side by side or in any close proximity. So everybody can be in their equipment on their own. They just increased, cleaning practices. So everybody's got a thing of Lysol wipes, and my mom has looked into installing plexiglass into the pickup trucks for when we do have to, have more people in the vehicle to go out to different farms, because our farms aren't just located in one area. So when they do have to drive somewhere together, they're considering installing plexiglass, much like you see in the grocery store, to prevent the spread between the people sitting in the vehicle. So definitely, they're definitely considering different things that we've never had to consider on our operation before.
Time for innovation, I guess.
Yeah, and the community's doing well as well. I think our community's pulling together because it is a local, rural, smaller community. Things are a little bit different, and maybe we're slower to change, I would say. But it is really great to see. We do have a lot of elderly people in our community, so there's not very many people out on the street. You don't see people gathering in driveways and stuff, which is nice. But even at our local grocery store, the firefighters have started delivering groceries, we've never had delivery groceries here, or even like pre-made grocery orders. Yeah. And so our firefighters are delivering groceries, which is really cool.
Yeah, that's awesome. Well, I'm glad to hear that the folks are doing well. The operations seems like it's still running, but just with some COVID innovations and some tweaks. But that's awesome to hear.
Yeah. Thanks for having me today, guys.
Thanks, Jess.
No worries. Thanks for coming.
The agricultural community and food supply chains have drastically been affected by the COVID-19 pandemic. In the longer term, this will influence the prevalence of food insecurity, and those from the lowest income households will be disproportionately affected if the supply and demand imbalance leads to increases in food prices. It is important that governments and non-governmental agencies work together to ensure that food producers, food manufacturers, and food transporters have the tools required to continually supply global communities. If sufficient measures are not taken, this could lead to other public health issues such as malnutrition and obesity. As healthcare systems begin to recover, we must still remain vigilant to ensure that families can access and afford the nutritious foods they need. Thanks for listening.
Remember, public health is a field of inquiry and an arena for action to improve lives one population at a time. This has been the Public Health Insight podcast. If you've enjoyed this episode, please drop us a like and follow us on Spotify, Apple Podcast, Google Podcast, or your podcast platform of choice. You can also send us your questions, comments, and suggestions for discussion topics at thepublichealthinsight@gmail.com. Thank you for listening, and we'll see you in the next episode.